pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanuatu on Facebook and YouTube every Saturday at 4 p.m. on the Online Pregnancy School as she discusses pregnancy, delivery, and childcare.
Welcome to the Online Pregnancy School, dear viewers. It is always a pleasure to come your way with very interesting topics. You know, when you have to do something, you need to plan for it. So my counsel is that don't just start things without knowing where they will take you to. Plan for anything that you want to do, and that includes pregnancy. Let's go for a short break. Welcome back. This is the Online Pregnancy School, and it is proudly sponsored by Promise Ghana, Vanuatu International, Reverse Tap, Samsara Ventures, and Erama Clinic. Please remember to call them and do business with them because you'll be very happy you did. Today we are going to look at another aspect of pregnancy and delivery. And after somebody has gone through 9 months of pregnancy, this woman has to deliver. But can she just get up and say that I'm going to the hospital? No. There are preparations that she has to go through. And that is what we're going to talk about today. Preparing for delivery. What does the family have to know? What should they do? And how soon or how late should they prepare? These are some of the points that we'll be discussing today. And my guest is a midwifery officer. She's Felicia Kale Dodu. She works at the Greater Accra Regional Hospital, or RAGE for that matter. And she's going to help us to understand what we should do as we prepare to deliver. Felicia, you are most welcome. So today we're going to talk about preparing for delivery. You are a midwifery officer. You have been seeing pregnant women coming for the antenatal, going through till delivery. And that's why I think that you are well placed to help us to understand what needs to be done. So, if we say birth preparedness and complication readiness, what do we mean?
And when we talk about birth preparedness and complication readiness, it means that preparing for delivery and then anticipating any complications so that there will be timely intervention if the need of complication arises.
So what is birth preparedness and what goes into that?
When we talk about birth preparedness, we have 3 things which come into play here. We have the clients preparing for birth, the community or family preparing, and then the health facility. So when we take the client, that is the pregnant woman, to prepare for birth, she has to prepare psychologically and physically.
Okay.
And when we come to physical preparation, the pregnant woman getting her stuff for delivery, such as her delivery items, which include things for the baby and things for the mother. And then when we want to go into it, we have the woman preparing in advance. So these are some of the things that she can prepare for the baby. That is the baby welcome dresses. We have chlorhexidine gel. Now that is what we use to clean the navel. We have baby diapers, hair wipes, etc. As the time goes on, I'll be showing you some of the things which she will need to get. And then when we come to the mother, she has to prepare for herself transportation, preparing in advance. If the husband has a car which can bring her in time of delivery, that is fine. But if not, she can make arrangements with any taxi driver or anybody in the community in advance to bring her to the hospital during labor. She have to organize some money, that is fundraising. We have health insurance, which caters for some of the things. But when it comes to the necessity that the health insurance cannot cater for some of the things, she will need money. That is why it is very important for her to gather some money, save some money towards the delivery. And then when we come to the family, she has to get a birth support person. That means talk to a member of the family in case the need for delivery comes. She will come with her, give her all the necessary psychological and physical support. When we come to the health facility has to prepare in advance for birth and complications. That means if it's a hospital, we have to make sure there's complication readiness tools such as emergency drugs, emergency packs, blood at the blood bank for the woman, etc., etc.
Now, Brofo Kesi, yes, birth preparedness and a complication readiness. Or children, or being tasked or children.
But children, Nyankopon Ninshishe mono, or Baba Faye Funo, na bosom in crown sono, say, or swen or asumjemo. But Nini mono, and ye nin say Ninana, etimiko ye. Ewo said ye no. Sometimes if we kakra beto chima say yes or ano. Inti brofia ye used to say birth preparedness and complication readiness ye just says oba fa ye funa said oba boa ne ho afa se okwa wo so na ebia problem bi si said ye betimi aso ano na no so enye client ne pe na prepare for those complications and I say those complications into your in shishaya ma opin for no the obeye opin for no the obeshin to ya obetimi atoto afa and ye want to ya ne family and I say ne community brono a otiso no ye ka brono a ne community na bi ye to say na sorry for ni nyina ye community a owom and na ye ba ne hospital once wa ye what the nurses for the doctors for and so be in case of emergency into be a case of birth preparedness and complication readiness yen shisheya ewo nipa amabubo so mien say nyina fa say ye behwe say complications bi ba wona wo so a ni etimi aso ano temtem so a
Into Brofo Kesi no mo kira anyin. Ladies and gentlemen, we are talking about preparing for delivery, and we have been told what birth preparedness means, and then also what complication readiness mean. You know, we use the terms differently. We don't say birth readiness because you have to prepare, because whatever it is you are going to deliver, so you prepare for that one. Now, the complication can happen when the woman gets into labor or even before she gets into labor, and she has to be ready for that. She has to be ready for that. And we have been told obia wo na says odoye maame no nyinsa no nukun ni fiefo brono wom community so ya shoro so ye kuo so ye baby otino obia wo na says a owo there oye. Let's go for a short break. Welcome back. We are talking about birth preparedness, and my guest for today is a midwifery officer, Felicia Dodu. Felicia works at the Greater Accra Regional Hospital, and because she's a midwife, she has seen a lot of women who have passed through the antenatal and gone on to deliver. So she is in a very good position to tell us how they should prepare, how pregnant women should prepare. And I hope that you will learn a lot. Please, if you have any question, send me a WhatsApp message on 059 242 0625. 059 242 0625. Felicia, so you have spoken about what the pregnant woman should put together. Can you show us what are some of the things that physically she has to put together?
All right. So we have some few things here that a pregnant woman must prepare physically. I have quite a few here. And then when it comes to, we have the bed mats. The bed mats. This is the bed mats. This is the bed mat. This is how it looks like. This is what is used to spread on the bed for delivery. We have pad. She can get more than 1, 4 or more, depending. We have some baby wipes here. We have baby diapers. We have the welcome dresses. We have a few here. This is how the welcome dresses look like. Then we have, she can get Macintosh rubber. It comes in so many Macintosh rubber for the bed. And then the most important thing, she shouldn't forget her antenatal card and her insurance. If she's the hospital card, she should go with it. She shouldn't forget her antenatal book. We have some shaving stick for the mother, some Vaseline soap for the mother. These are part of the baby dresses. So physically, these are what the woman have to provide and more.
Somebody will be asked, aren't they expensive? Are there alternatives? For example, if I cannot buy the baby diapers, can I come with something else?
Yes, you can come with napkins, provided that is what you afford. And then we have 9 months of pregnancy. So these things, even though it might be expensive for some people, so it is advisable during the start of the labor, you buy them in stock. You buy them one at a time, not to wait till the 9 months before you are looking for money to go and buy all these things. It might cost you. So you can buy them one at a time before the time for labor reaches.
Amafo zaye kanyi de nzema oda chire ni nyina no hia sere kwakwa no hia no se mentwan na bosom no wedru akono na ansana ayede miniska nti na mi de mrokwa muntu mfa hwenko onum ponti no obi no mebonda won pede wokọ wo hospital ena waka bi osu de se e wo napkins a ebotum za akọ na ni nyina obobua ni nyina abobua. Felicia, you showed us the blue and white thing, and then you also showed us the green plastic cover. Do we need both? Should the woman have both of them?
Yes, the woman can bring both if she so wishes. She can come with the diaper and the napkins. But if she can afford the diaper, she can come with the diaper alone. If she can afford the napkins, she can come with the napkins alone.
You know, you showed us the green, the green sheet, and then you showed us the blue and white. The first one that, yes, this one and the blue and white one. Are both of them needed? Should she have both?
She should have both. Why? Because this is a rubber marking. This is a bed mat. It is made of cotton.
Okay.
But sometimes we have rubber at the back. But sometimes we cannot anticipate the holes that may be in it.
Okay.
So it's advisable she come with both. We spread this on the bed, then we add this one.
Okay. And then, just for clarification, you said she should come with how many packets of pad? The pad?
Yes, the pad, she can come with 4 or more. Sometimes we cannot anticipate how she will bleed after delivery. So she will need more. So if she can afford 4 or more, it's fine.
What is the pad used for?
We use the pad to replace the pad in their pants after delivery. Because after delivery, we have something called lochia. The woman will bleed for some time. And this is what we use to stoke the blood. Okay. So it's very necessary.
Okay. And even during delivery too, the pad is helpful in delivering the woman. So that is very good. Ladies and gentlemen, this is the online pregnancy school. My name is Dr. Linda Vanotu, and today we are talking about preparing for delivery. My guest is a midwifery officer, and her name is Felicia Kale Dodu. She's a midwifery officer. They have seen so many pregnant women through the place that she works, and therefore she's telling us how we can prepare very well for delivery. Felicia, when should the woman start preparing?
Right from the onset of pregnancy. The woman can start doing the physical preparation. That is getting the items for delivery. And then when the woman gets to 36 weeks, that is from 36 weeks ongoing, the woman can go into labor. So we advise that when the woman gets into from 36 weeks going, she should bring somebody to donate 1 pint of blood for her. That is very necessary because sometimes when they go into labor, we cannot anticipate the blood lost. So it is very necessary they get a donor to donate a pint of blood to keep at the blood bank for them. So if any obstetric hemorrhage occurs, and then the client needs blood, we give this blood to resuscitate the client. It's very necessary. So they can come with a relative, the husband can do the donation for them. Anybody in the family can do that donation for them.
Okay, so the blood, sometimes people think that I don't have to donate, I can just buy from the hospital. Is it for sale?
You need a relative to come and donate for you, a friend, a relative, somebody in your community who wishes to donate for you, it's fine, but the blood is not for sale.
Thank you. Ladies and gentlemen, that is a very important point because some people, when they donate blood and the blood is not transfused to their relatives, they want to go back and demand for it because they think that the blood is for sale. Blood is not for sale. It is used to save lives. And you can have a woman coming in an emergency where she has bled for a long time. It is important to transfuse her immediately Sometimes the relatives go round looking for people to come and donate, and they don't find anybody, or they get a few, but the woman needs more blood than they have been able to donate. And this is what the blood that is in the blood bank is used for. And I'm sure you are even aware that sometimes we have blood donation exercises and men donate. As a baby moja to na wasn't man. So if you donate blood and by God's grace you don't end up receiving blood transfusion, I think you should be grateful. And you should also be happy that you are helping somebody to survive. That is very, very, very important. So the blood is very important. Okay, Felicia, let's go for a short break. Ladies and gentlemen, welcome back. So Felicia, now you have told us about the preparation that this woman has to make. What about the man? Is there anything that the husband has to know and prepare for as they get close towards the end of pregnancy?
Yes, the husband must make sure that there's a transport available. And then a best support person can either be the husband or a relative. Then we need the husband to psychologically give the support. So the husband here is very necessary in the birth of the wife, because the transport must be catered by the man. If the woman is in labor, you can tell sometimes they don't even know what happens around them. So it is the man who makes sure she calls the driver or bring her, make sure she carries her bag that is packed into the car, and make sure if there are other children in the house, she leaves them in somebody's care so that they can come into the labor. But one thing I want to add is that when these women are coming for labor, for birth, sometimes we have clients who are hypertensive, diabetic patients who comes into labor. Sometimes some of them leave their medication at home and they come into labor, and then their BPs are high. Sometimes we can't get the relative to go and get their medication. So I'll use this opportunity to tell all pregnant women, when you are on any medication and you are in labor, you try as much as possible to come with your medication. It is very important.
That is a very important point. Amafo, zaye kenyi de. Se ehwehwe wonzama na akwa na se ewedru bidra memma wu winfir. Osande edru no ho hie nti na wode mo no. Nti sereko hospital ayafa ka ho ko. Na ikunom nso wa kire henda owode woye. Na se woye reko akwa onye ehwo no na mana na ehwehwe dem ka fra abraka na oza akọ dem na woka kire oda wara esesie wo ho to hode se awo ka meyira dem kaali na mde bokọ se wankasa ewo kaala nyame na adom oye na se enyi bi wo fi a oda ehwehwe kaala ezibokọ ehwehwe sika ezibotu akaw ehwehwe bebi obokọ akọ po ni nyina ohia nti wose de papafo no nso wo wedwuma kakra na woye. Felicia, so how will the men know? Should they come to the antenatal, or you tell the wives to go and tell them? How do they get to know how they should prepare for this?
Now, what we encourage is male involvement or husband support during pregnancy. Most of the times, our clients, we ask them to come with their husband, if not every time to antenatal clinic, at least we have 3 semesters, the first trimesters, the second trimester, and the third trimester. So they can come with them at least once in every trimester to know what is going on. And when we have male involvement, it's best for us to take the good decision for the woman, because the husband is there, the midwife is there. Then you plan everything. If you identify any complication, even during antenatal, because the man is there, you try to talk to them for him to understand. Sometimes when we tell the woman, sometimes the miscommunication, they don't tend to get us. So if you back clinic, now we say and say you make a decision. Sometimes a boy papa into your say first 3 months, at least in back clinic back 6 months on an before 9 months, no so on an and no a decision no very good. Into male involvement, your bomb a basso papa. Now your male involvement.
Yo, male involvement, may punch a while. Then be safuja, Ekadon ye de possum kakachi mukun. The male involvement is very important. You see, when your wife is pregnant, she has 9 whole months, everything being equal. And you have an opportunity to know what is happening to the baby and also to the woman. So take advantage and go with them at least 1 per trimester. 9 months mean I will 3 times per. Because that will help you to understand what is happening and also help the woman to make a decision. Because if she goes and the nurses tell her anything, the midwife says anything, the doctor says anything, she will say that I'm going home. And if she's supposed to come in a month, it means that there's 1 month delay. And that is not good for the child and also for the woman. So it is very important. Felicia, you showed us the antenatal card. And you said it's very important that they bring it. When they are at home, is there anything that will help them to know how to prepare? Is there anything in the book that the woman has to know, the man has to know, will help them to prepare for the delivery?
Yes, please. I think 5 years ago, 4 years ago, no. Beka na book way ni ho. See a book way maternal and child health record book. See a book way no ye use throughout pregnancy and then postnatal. Na a lot of information ye dia disua dia bebre ego book yi mu. Ewo bra oba na fa yefunu. Even immunization e se won fa. Name dry say one fa education sayama ni nyina wo book ha ebimpo sometimes say oba nimpo ekọ awo so a ye wonye ma bia ebe kire say awo na aka no ye wo danger signs nyema bebre. This book is it contains a lot of information about the pregnancy and childbirth. Nti ye best say so mo wo fie kwa omo betimi akenkan no mo question bi no mo ba antenatal a ometimi ebisa tiniema bebre wo mu a eye adesuade ema openfo ne nebusua.
Ladies and gentlemen, this book is given to the woman to take home, and it is not just because she has to take it home, but it is so that the husband can also see what is happening. Inti yesra honda sa wo yenyinsa na ochedo wo book bi wo ho inti ya age hwem na entase no kechende okwa ombisa ebotum nyina akwa enye no nko na etume ebisa ho asam. We are talking about preparing for delivery, and this book is very important because it keeps record of all that the woman is going through from day 1 that she went to the hospital. Into a very important book owodo bia etum ehwem ebia na health for him brofo na yetro no antase papa na ma ho kra bomodina na efi bisa midwife no se maame no po ebisa na wentu menyi wana onye haw kachende so kom bisa de yo dan she will ask, it will be explained to her, and she can come back. But as we said earlier, it will be very good that as a husband, you join your wife to the antenatal at least once per trimester. The other thing is that this is the online pregnancy school, but we also have the physical one. Your pregnancy school are and you know kobia no so obeboa ebenyamber ebisa midwife no za worka na za waye na nyina ni nyina obeboa papa ni nyina no ho hia. If you have any question, please send me a WhatsApp message on 059 242 0625 059 242 0625. Felicia, we have spoken about the blood transfusion, but if somebody's HB is okay, if this person is not anemic, does she still have to donate blood?
Yes, please. She have to donate blood. As I said earlier on, said the Mexican infection, say oba kwa waswa. Sometimes moja na ebetunu no yentimi enchire efi ewo mra oye pregnant. Inti umoja no baby edudu no ebetimi aye fine kama umoja no was so fine. But sometimes so kwa waswa niema bebre timisi ebia obewe na moja too. Na moja na ewo umuno bebra besenko na chese moja na eswa yede eswate inti ehia se opinfo biara so HB ni wasro so moja no wo fomo ehia se wo be donate moja eno na ya fe no complication readiness said ya be ya wo kwa wo so na moja na ese into no etu wo bro saa de betimi de saa moja na amawo into moja no ebetimi was so fine ba obetimi abewo no moja betimi etu bebre ama ebehia se yebema moja inti opinfo biara bebi a moja dudu bia e was say undonate blood into wo emawawo.
Somebody would like to know, in your experience as a midwifery officer, are there some issues that pregnant women go through that the general public has to be aware of? Because somebody may be listening, but I know that people still come to labor without having prepared very well. Why does it happen that way? Why is it that somebody would come for antenatal maybe 4 times, 6 times, 10 times, but still will come unprepared? What happens?
Sometimes the woman said there kind of male involvement. Sometimes right from day one, you don't be fun yema bebre mu addition bebre mu na yenim se wunni nimdia unnim but we no ye de omo fan chechere mu bebre e wo antenatal into your mom adequate information. But ninse mu no enye ba ko pe nipa ba ko na enyem but enye nipa ba ko na eyese onhwe. Inti sometimes the problem aye hu ni say family no decision making one of a major problem because obi be kwa was no obeka se o mi fie ana obi se ni eye no inti awaka no na owo fie no eye se on sorry embra to prevent say delay no obetimi atene fie ma o twen kakra we dia kola na tete ne ho oye sei ni nyina no na edi delay ba eniti na yesre say opinphobia de ni kunu ne ho kafo ebeba hospital. Now sometimes you bet sure say how to make decision because or delay in decision making say obesity health care. Sometimes a bit may delay all the steps in giving even emergency care. Into sometimes more problems are no decision making because ni kuni na mbano or kase ya ni boy brakaka ni mami say ni sister say into sometimes here family member or antenatal ni ani omotina say okay say na ya wo yiri na ye chiro mu nyema nyina the normal things that should happen in pregnancy and that the abnormal things that should happen into say ye nyomwa now they don't delay even in decision to seek health care.
That is very important. You know, the pregnant woman hears a lot of voices and she listens to a lot of people, but her life is important. Unfortunately, the time now, the life here at risk, that is the time that her voice is very small. Nankasa no nyinsa no, at a point where her life is on the line, that is when she cannot make any decisions for herself. And that is why we are saying that se obi nyinsa na nimpa oboboa no ma waye decision no onye no call hospital no adoro antenatal no. If she does that, then this person at least can speak for her at the time when she needs an intervention. Senuku na nkobida na onyimi there na awode o donate blood into 1 year anapo be fie no ka eche no wankasa no ho. Now she goes into labor. Unfortunately, she starts bleeding. Blood bia anyi ho a ono wa twesi ho a whatever man into hona ne de no no worka for no wada man ahwe ya na waka ya how. That's why Felicia is saying that decision making or very important. Who helps this woman to make a decision concerning her delivery? It is key. Me just there na we planning no do no list on or don't know number one. Nimpobo one ma why a decision or number one. Sometimes women even lose their lives because the person who has to make a decision for her to go through a certain procedure is not available, or because he or she doesn't understand, will make the wrong choice, and that will end this woman's life. Let's go for a short break. Welcome back. Today we are talking about preparing for delivery and getting ready for complications in pregnancy and delivery. And my guest is a midwifery officer, Felicia Kale Dodu. She works at the Greater Accra Regional Hospital, or RAGE, and my name is Dr. Linda Vanutu. This program is proudly sponsored by Promise Ghana, Vanutu International, Reverse Tap, Samzara Ventures, and Erama Clinic. And if you have any question about what we are talking about today or any other topic in pregnancy and childcare, please send me a WhatsApp message on 059 2420625. 059-2420625. And don't forget to visit my Facebook page at Dr. Linda Vanutu to look at all the various topics that we have discussed, and visit my YouTube page also and subscribe. Sound Health and Investment, SHIC Ghana TV, or you get my name and you will be there. Subscribe and please share with friends and with family. Felicia, now you talked about the hospital's preparedness. What does the hospital do in anticipation?
The hospital have a lot to do when it comes for complication anticipation. That is our emergency pack, our emergency medications, resuscitation, that is oxygen, etc., etc., and even the blood, making sure that your blood is at the blood bank in case of any transfusion. So the hospital makes a lot of preparation towards a client's delivery and to anticipate for complications. So these are some of the preparation we do. We make sure our emergencies pack are set, our delivery, our resuscitation items are all set for the delivery.
We didn't mention anything about food or beverage or anything. Should she take that also into account when she's coming?
She needs to go with a few provisions like Milo, Lipton, milk, biscuits, bread, because sometimes when they deliver, they stay in the hospital for us to observe before they are discharged. So at that time, even in my hospital, food is served, but you can come with a few provisions.
Okay. Now, if a woman doesn't prepare well, we know that if complications happen, she may not be able to withstand how this will affect the pregnancy. Do you get a lot of women coming to the hospital unprepared? That should make us concerned and talk about issues like this. Are there some women who come unprepared?
Okay, for what I know is that sometimes when they come, some don't anticipate that maybe from a lower facility will be transferred to a higher facility. Some think, oh, they'll go through the labor normally. Sometimes they go to a lower facility and then there's the need that they bring them to a higher facility. So Mecca says that sometimes, prepare. Don't prepare limited to a clinic be a benwa. Yes, I won't prepare say, semi-coho na in case say the medical hospital kesiemu. Intino obaye inshisheye ninyina ewo this level. And no, we have a few people ebia omaba ina they didn't anticipate say ye be transfer nako a higher clinic. Inti inshisheye no anshishe no ama nendu sa level no. Inti yebe yuso akunye say so wo clinic bia even though bia waboabo osika no kakra wape wonkwala niema kakra yes I am prepare ahead so kakra because wo ho na bia based on their setting and I say specialist bia ni ho bia BBC a obetimi ahweme a ehia say ye de obekọ hospital a eso saying bia baby a wakono nti mestres say more prepare so a they should prepare higher than where they want to go and give birth.
And it has happened very, very, very often. There, obi wo ho a wa baby or akọ odu ho was ma me ye hwe no e bia dem osima wonere ye no ode ye zo kokesim hey na na akometu. Nti no Felicia say yere ya meme ye hwe baby na ye kọ no nkotin ye hwe de se oban there and being sent up to a higher facility, I will be able to go. And that is where the complication readiness comes in. So don't limit yourself to the lower level. say maame na mfa de call health center na polyclinic bia mema enfo wadwene nsi ehon kote do nti no ekọ no waka cho de yezoro kwakasi mpe na wakometu obi no mpa waka na weguan waka dey maame ode kwa hede ya ofi hope onko na okọ baby fufura ebi po wo fomison baby okre no obandama na waye haw ozama abofra no na onye maame no nso. Felicia, now we are bringing our conversation to an end. Are there any other points that you want the pregnant women to know, their husbands to know, and the general public to know?
Okay, I have some few things I want the pregnant woman, their families, and then the general public to know. There will be say tall, say yebe two and among akoshe baby a yebe wo. Sometimes hospital baby no ye antenatal no ye different from baby a yebe jiwa wo no. Obi wo hono ma oko hospital oko antenatal clinic, but ebia awo kana onim labor ward ho as ebia most of times awo bebre come anajo. Say ebia ka wanajo a antenatal clinic no wo time ayede pon ebia be ka wanajo sa time na antenatal clinic ni ho eyese wonko hu baby a wo kan wa labor ward eyese wonko and then also eboa bebre. So what's me call labor ward? You will be a fan at all, labor ward tour and a hospital tour, theater, ni in Yama baby. Yet them almost fast at tour you more. Sometimes almost cry midwives be more nim. Oh, I walk a you are so lucky to go and meet midwife when nearby tour ye be no. Oh, cry to me who yang in near me be a yet me be ye juma. Obi Honmora hospital, person and now can na come to based on in near be obi who labor ward any adiade. Intimate say oba fire funa oba antinentala. There will be a friend or labor ward tour and a hospital tour. So omo kwa no sibebo mondia so obedi echire. No akohu baby a walk na obetimi akọ at least ukohu light bi wo ho a embo hu wehu dada. Na on fast stress be call labor mo or call labor she's at ease because Sanya money nina who said a certain ethnicity.
I've seen the tours where men were actually in front going to see where their wives would deliver, and they sometimes allow you to even peep so you have an idea of how the theater looks like, because some people they are afraid of the theater and to normal person. But when you are prepared psychologically, then you have a good view of the whole hospital. Nti sa na adwene ye do ba ya onim say oh me ba ya na ye call tour no ye can say delivery room e wa ha say. Nti instead of going this way, let's go that way. Eno so be bo bebre. Today we have been talking about birth preparedness and complication readiness. How a pregnant woman and the family can prepare adequately for a safe delivery and also be ready for any complication that might occur. Our prayer is that pregnancy will go on successfully. And so you know the baby, then you might have a complication. You should be ready for that. My guest for today is Felicia Kale Dodu. She's a midwifery officer, and from what she has told us, you realize that she has actually worked with pregnant women. She has enjoyed her work. You can see from the way she's talking. She has shown us some of the things that you would carry to the hospital. Amafo ndeza yeka ho asam no oyede erebobo wo ho na sa wo kan wa etum akwa asomdwem. Mpo so bendo the way operation pa na esese wo ho dadaw. Nimpa me ne di dwumende oye midwife wa hwe wo midwifery na wo friend Felicia Dodu. Felicia achechre hen nzama yerekwa akwa ye betum ya bobo ano na ye za akọ na mo ye de wo ho yi de mentwan na edi bosuma akono na nsa na ahyase dem ka gina gom na matoto nzama onyeye nti tonen kakra da mara anti Felicia nti apemfui wo ba wo ade bia wo de boa hon ma wo hu de dami nzeme na wo hia da wo de ba na ma wa hyase wa prepare ntama
pacho ye wo bibia ye de mom e list we no enema a ye pese omfambra awo so no ene de ebe bom emergency transportation fundraising, your national health insurance card, emergency person contact, ni nyina wom answer ya ba items for mother and items for baby. Inti ebuama opin for etimi yusu ye list way etimi de boaboa na ho.
That is very good. So ladies and gentlemen, today our topic has been very interesting. My guest is a midwifery officer, Felicia Kale Dodu. She works at the Greater Accra Regional Hospital, RAGE. And you see, the beauty is that the hospital over the years has improved and therefore knows what to do to help pregnant women to go through pregnancy successfully, including planning and preparing for delivery and complications. So it's not just you preparing for delivery. Everybody who there what chuma dun so gina do de bia na we ka hia da way operation ni nyina aka ho se bet da min se mi nyinara na o che do de continental na erekoso nso abomodena na enyo obi nko na no so ntibi oyendama obobua. Felicia, I want to thank you so much for this very beautiful discussion. It has been very good. And I am sure that the pregnant women, the husbands, and even others who are yet to be pregnant have learned a lot about how they can prepare for their delivery and complications. And my prayer also is that the hospitals will continue to prepare very well so that when the women come, they will be ready for them. My name is Dr. Linda Vanutu, and this has been the Online Pregnancy School. I hope you have learned a lot. Please share with friends and family. Visit my Facebook page, Dr. Linda Vanutu, and visit my YouTube channel as well, SHIC Ghana TV. And you will learn a lot from all that we have done in the past. Till we come your way again with another beautiful topic on pregnancy and childcare. Take care and have a good day. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the Online Pregnancy School as she discusses pregnancy, delivery, and childcare.